Here's something most people don't realize until it's too late. Hearing loss is not just an ear problem, it's a brain problem. And that's what we're actually talking about here. I had a patient tell me once, I can live with missing words. I didn't know I was losing myself. We've tended to treat hearing loss as a nuisance, kind of like bad eyesight. But untreated hearing loss has far deeper consequences. And here's the part that really matters. When you lose your hearing and don't treat it, you're not just missing conversations. You could be increasing your risk of developing dementia. I know that sounds scary, but here's the good news. Hearing loss is one of the largest modifiable risk factors for dementia. That means it's something we can actually do something about. I'm Dr. Layne Garrett, founder of Timpanogos Hearing Tinnitus here in Utah, and I've seen firsthand how life-changing hearing care can be, not just for hearing, but for memory, mood, and connection. That's what keeps me doing this after 20 years. And today, I'm going to explain exactly what the research shows about hearing loss in your brain and why this connection exists, and finally, what you can do about it. Let's start with what we actually know. The 2024 Lancet Commission on Dementia identified hearing loss as the single most modifiable risk factor for dementia for midlife. That's huge. They're saying that addressing hearing loss could potentially prevent more cases of dementia than targeting any other single risk factor we know about. A 2024 meta-analysis published in Aging Research Reviews looked at 50 different studies involving over 1.5 million people. Here's what they found. People with hearing loss have higher rates of cognitive decline, mild cognitive impairment, and dementia. And then there's important to remember there's a dose-response relationship. For every 10 decibels of hearing you lose, dementia risk increases by 16%. Let me put that in perspective. If you go from normal hearing to a mild hearing loss, which is defined as about 25 to 40 decibels, you're looking at a significant increase in dementia risk over time. Johns Hopkins researchers found that people with moderate to severe hearing loss had a 61% higher prevalence of dementia compared to people with normal hearing. Now, I need to address this clearly. Do we know if hearing loss directly causes dementia? We don't know that for certain yet. But here's what really makes this important. Recent research is showing us that there are some plausible mechanisms that might explain that connection. So how might hearing loss and cognitive decline be connected? Researchers have identified three main pathways that could explain the relationship, and I want to explain each one of them in plain language. First is changes in the brain structure. Researchers have found that people with hearing loss tend to have reduced volume in certain brain regions, like the temporal cortex, the hippocampus, and areas crucial for memory and thinking. A 2022 study published in the Lancet's eBiomedicine examined over 168,000 participants and found this to be true. Now, we also don't know for certain whether the hearing loss is causing these brain changes or whether there's some common underlying factors affecting both hearing and brain structure. But one theory is that when your auditory cortex isn't getting clear sound signals, those neural pathways will weaken over time, similar to how muscles atrophy when you don't use them. And it's not just in the auditory areas. People with hearing loss show differences in many brain regions that have nothing to do with hearing loss. Areas like memory, spatial reasoning, and executive function. The second one is increased cognitive load. This is probably the easiest mechanism to understand because you've likely experienced it before yourself. When someone has hearing loss, their brain has to work much harder to understand speech. You're constantly straining to fill in the gaps, to figure out what people are saying from the context of the conversation. That extra mental effort, that's called cognitive load. And here's the theory. If your brain is using all that extra energy just to understand what people are saying, you have less mental resources left over for anything else, for remembering what was said, for complex thinking, for making decisions, etc. I see this pattern in my clinic all the time. People with untreated hearing loss tell me they're exhausted after social events or meetings. Whether this chronic cognitive overload contributes to long-term cognitive decline is still being studied, but it is a plausible pathway. Let me say that again. You don't get used to hearing loss. Your brain gets worse at listening and remembering over time. It's like trying to run a race with weights tied to your legs. Eventually, your whole system adapts, but in the wrong direction. And third, there's social isolation. This one might seem obvious, but it's critically important. When communication becomes difficult because of hearing loss, people often start to avoid social situations. They stop going out to eat at restaurants. They stop going to family gatherings. They start to withdraw from activities that they used to enjoy. and social isolation itself is a major risk factor for cognitive decline. So it's possible that hearing loss leads to social withdrawal, and the social withdrawal contributes to the cognitive decline. Again, we can't say for certain that this is causal, but it's a plausible mechanism. What we know is that these factors, hearing loss, brain changes, cognitive load, and social isolation, tend to occur together. What we're still working to understand is exactly how they're related. If this information is helpful, let me tell you about Robert. He was 68 and he'd retired about 3 years before. His wife had been pushing him hard to get his hearing checked because she had noticed that he was withdrawing. He wasn't going to church anymore and had stopped meeting friends for lunch, and spent most of his time just at home watching TV. When we did his hearing test, we found he had a moderate hearing loss that had likely been developing for years. But here's what really concerned me. His wife mentioned he'd become much more forgetful over the last year. He'd repeat questions, forget conversations they'd had, he'd miss some important medical appointments. Once we knew about the hearing loss, we got him fit with hearing aids using proper real ear measurements to ensure that they were programmed correctly. Within about 2 months, his wife called me in tears. They were happy tears. She said it was like getting her husband back. He was engaging in conversations again. He had rejoined his men's group at church, and she'd noticed his memory seemed sharper too. Now, did treating his hearing loss cure any underlying brain changes? No. But it removed a major barrier to cognitive health. His brain wasn't straining so hard just to hear anymore. He was socially engaged again, and that matters enormously for protecting brain function as we age. A lot of people treat hearing aids like readers from the drugstore with their eyes. If it gets bad enough, I'll just grab a pair. But real hearing treatment isn't about making things louder. It's about retraining your brain to listen through precise fitting, follow-up care with your audiologist, and support. That's what makes the difference. And the longer you wait, the harder it gets, not just for your ears, but for your brain to bounce back. And here's what the study found. In the overall group, hearing aids did not show a statistically significant reduction in cognitive decline. But, and this is important, in the subgroup of older adults who were at a higher risk of cognitive decline, the hearing intervention reduced cognitive decline by nearly half. Now, the study did not prove definitively that hearing loss causes cognitive decline. There could be other factors at play. But it does suggest that people who are at higher risk for developing dementia, treating hearing loss might provide real benefits. A more recent research from the Framingham Heart Study published just this past year found that people who used hearing aids had a 61% lower risk of developing dementia compared to people with hearing loss who didn't use hearing aids. Again, this is important. This benefit was the strongest in people who got hearing aids before they turned 70 years old. Whether hearing aids are directly preventing brain changes or whether they're helping through reducing cognitive load and increasing social engagement, we're not entirely sure yet. But the intervention studies are showing real benefits. So what does all this mean for you? Here are the practical takeaways I want you to remember. First, get your hearing checked regularly. The American Academy of Audiology recommends baseline hearing tests starting at age 50, then regular screenings. Don't wait until your hearing loss is severe. Earlier detection means earlier intervention, and that seems to make a real difference for brain health. Second, if you have hearing loss or suspect you have hearing loss, get it treated properly. And I emphasize properly because just buying hearing aids isn't enough. You need comprehensive hearing testing, proper fitting of your hearing aids with real ear verifications, and follow-up care. Research shows that people who work with audiologists and get the right fitting and support are much more likely to wear their hearing aids consistently. And consistent use is what provides cognitive benefit. People often shrug off forgetfulness as just getting older. But what if it's not about aging at all? What if it's actually something you could treat? And ironically, the thing many people are afraid of, wearing hearing aids and looking old, is the very thing that could prevent them from aging mentally and socially before their time. Third, stay socially engaged. Even with hearing loss, keep doing the activities you enjoy. Use assistive listening devices when you need to. Ask people to face you when they talk. Creating communication-friendly environments also matter. And fourth, remember that treating hearing loss is more than just hearing better. It's about protecting your brain health, maintaining your quality of life, and staying connected to the people and activities around you. If you'd like to learn more, we've created a free comprehensive learning center that dives deep into the research on tinnitus, hearing loss, and cognitive decline. It also includes strategies for protecting your brain health and questions ask your audiologist before you visit. I'll put the link in the description below. Bottom line, the truth is, we don't know with absolute certainty whether hearing loss directly causes cognitive decline or whether they share common underlying causes. The research is still evolving here. But here's what we do know. The association between hearing loss and dementia is strong and consistent across dozens of studies. The proposed mechanisms are plausible, and most importantly, intervention studies are showing that treating hearing loss can provide cognitive benefits, especially when addressed earlier in life. So while we wait for the science to give us all the answers, treating hearing loss is a low-risk intervention with potential high-risk benefits: better communication, reduced isolation, less mental strain, and possibly protecting your cognitive health. If you're here in northern Utah and want to get your hearing checked or discuss how to protect your brain health, you can schedule an appointment in one of our clinics. There will be a link I leave in the show notes below. We've helped thousands of people preserve their hearing and their cognitive health, and we'd be honored to help you too. Now let's keep this conversation going. Have you noticed connections between hearing loss and memory in yourself and loved ones? Has treating hearing loss made a difference? Drop your experience in the comments below. Your story just might help someone else take that first step.
A world of better hearing and relief from tinnitus is within reach, and we're here to help. Be sure to subscribe to the podcast right now and join us on the journey to clearer sound and a richer life. Thanks for listening to the All Ears Hearing and Tinnitus podcast with Dr. Layne Garrett. We'll see you next time.